Thank you, Dr. Damon. And I'm personally just humbled to be a part of this study. Just like Tom and Mike, we've been a part of numerous product developments in the past, and nothing has been as detailed and organized as this study. I'm sure you all would all agree.
Todd, I couldn't agree more. This study is, I think, is going to be a landmark study. The data will speak for itself, and I think it does take a great system and it makes it even better. So I can't wait to get into this with you guys.
Yeah, thanks, Tom.
Well, I mean, I think what's great about this study too is that we've got so many different operators that have their own practice style who all came together, and we took just phenomenal detailed records at certain time points. So not only was it just an amazing opportunity to be part of it, but the data that we're going to get out of this moving forward is just going to be unparalleled, and we're going to find a lot of things that we maybe didn't know. And just to capitalize on what you said, Todd, is without innovation, our profession doesn't progress as a whole. And I think that we do have to thank people like Dr. Damon and everyone who thinks outside of the box and pushes, sometimes when the door is closed, and Ormco has been a huge support of that. And it's one of the reasons why I love partnering with Ormco, is because they do help our profession move forward. And for that, I'm truly grateful.
Well, thank you. Now I'm just going to share and just get into my portion of this presentation. And what I want to talk about is in phase one, as I would like to call it, with the 14x0275 Ultima wire in the Ultima system. So as we transition out of the round wire phase that we've all enjoyed and loved with the passive self-ligating system, we love going into those exams where there's been a lot of crowding with blocked out teeth, et cetera, because we know that round wire phase and that passive system is going to, that crowding is going to, if we do the right mechanics, it's going to lead to transverse development. And as we know, there's going to still be some rotations as we come out of the 18 copper nitide. So with the 14x0275, what I want to do is set this up. I'm going to show 6 patients, and I want you to think about 2 things. There's really 2 different motors, as I would call them, in this 14x0275 Ultima wire. The first motor, as you can see in these cases, is the rotations. There'll be a motor there, and that motor is what I like to call an activation. So anytime there's a rotation, there's going to be activation in that wire, and that's the smaller motor that's going on in this Ultima wire. And then secondly, but perhaps more importantly, is the second motor, which is the larger motor. That's going to be driving our transverse development. So let me explain further. So as we see here, this is the first visit back with this gentleman, Josh, and I put an 18 copper nitide in, just doing round wire mechanics, and engage that upper right 2. And then the third visit back, you can see the deflections in the wire in the upper right 5-6, the upper right 3-2, the upper right 2-1, and so on and so forth. You can see the rotations and the deflections in that wire. The next visit back, as depicted in picture 3, we have the 14x0275 in full expression. So going back to this motor concept, in slide number 2, in picture 2, all those little deflections in that wire, especially the upper right 3-2, the upper left 1-2-3 area, those deflections, those are your smaller motor. And that motor is driving those rotations to be corrected. Once those rotations are corrected, then we're driving that larger motor that is working on that transverse. So let me make it a little bit more clear. Here is the 14x25 wire that we're all accustomed to, and that is in the 022x028 slot Damon Q2 lumen. And you can see there's all sorts of play in this bracket wire complex. What I'm talking about with the Ultima wire is this right here. This is the heartbeat of the Ultima wire. You can see the 0275 component here. It's still a passive system. That's very important to realize, is it's passive. There's not full contact on all sides of that wire. Obviously, the 14 dimension, and when I hand this off to Tom's going to talk about the 18x0275, and he's going to have complete vertical contact with his wire. But with the 14, we've got slop in the superior and inferior dimensions. but that wire is almost hitting that slide door. So that larger motor I'm talking about, when those rotations are corrected, then that wire is going to contact that slide door and really work on that transverse. So here's patient number 2. We can see just typical case, block that upper right 2. There's the day of bonding and did an open coil. We still want to do our open coil mechanics when needed. First visit back, I engaged that upper right 2 with a 14 copper. Not too many deflections in our wire. I really want you to pay attention to the upper ones. So we start to study our bracket placement there. And the next visit back is when I put the 14 by 0275 Ultima wire in. And really notice the upper right 2. There's a lot of deflection there. And really pay attention to the upper ones. And you'll notice the next visit back in picture 3, we've got full rotational control. Now, that is really important to pick up on. Those upper ones, that's when in the past we'd look at that and we'd say, well, is our bracket in the right spot? You know, how is this really going to resolve? And sometimes it would resolve and sometimes it wouldn't, because that 14 by 25 in the Q2 slot, sometimes we weren't getting those deflections. Let me put it this way. If there's no deflection activation, there'll be no correction. So you can see that deflection in those upper ones, and then full expression there, we have full rotational control. I'm going to show the lower just to talk about that second motor. You can see the 18 copper on the lower, not many deflections, not many rotations there. And then we go to the 14 by 0275 Ultima wire, and then full expression. What you can see is just the teeth uprighting over the basal bone and just getting that transverse development. At some point, the 14 by 0275 it will never net 0 on picture 3. What I mean by that is, yes, that wire is contacting the slide door and it's getting transverse development. So as we resolve these rotations, these deflections in the wire, as those rotations correct and this transverse is working, at some point the force will just be too low and the transverse will stop working. Here's patient number 3, and you can see here at bonding, we've got quite a bit of rotations in the premolars and the lower left 3-2 area. Same thing, first visit back, I bonded 7s and I put the 18 copper in, still quite a bit of deflection, quite a bit of rotations in that 18. As we move out of the round wire, again, most of the time, we're still going to have some rotations. We all expect that. And that's what you're seeing in picture number 2, the third visit back after bonding. He still has some rotations. There's still deflections in the wire. Remember, if there's not a deflection, if there's not an activation, there'll be no correction of the rotation. And then you can see in the fourth visit back, slide number 3, 14 by 0275, full expression wire, we are, in my opinion, just rotation free. And that's just really good to see from the second visit back, picture 1 to picture 3. I know Tom, Mike, if y'all want to comment there just in the transverse and just that idea of motors, is that making sense to you guys?
No, absolutely. You know, the no deflection, no correction is absolutely key. I think in the past, a lot of us lingered too long in those round wires and they had done their thing and we stayed in for weeks more. So that can't be emphasized enough, that no deflection, no correction. And again, the passivity, so people may think like, well, isn't that kind of going against the grain? Don't you want to be, you know, loose and for a long time? You know, I suppose in the very crowded cases, you do need to go a little slower and maybe let those wires cook a little longer. But the passivity, we're going to get it like we always got it in the 014s, 018 round wires in the first stages. So, I mean, it can't be emphasized enough. No deflection, no correction, and don't waste too much time in those cases where you don't have to waste it that, you know, aren't severely crowded.
Well, and I think that drives the point that we're not trying to find a wire that we can cram into these brackets so that it does all of the work for us. I mean, the round wire phase is crucial. It allows biology to start waking up. It allows for the vasculature to start really allowing for natural tooth movement. And there's no friction and there's no binding in those 014s and 018s. So when we do progress to that first Ultima wire, what you're showing that is just really quite amazing is you see the rotations, you see the deflection of the wire, and then a short period of time later, you're seeing transverse dimension, which helps us with the crowding. And then you see the control in the rotation, which helps with the tooth alignment. I mean, in a first rectangular wire, we've never really seen this type of correction. And you're showing that case by case. And one of the things that I really think is important is that when we think about the Ultima study, the people that got these brackets, we came back and we put them on all of our patients in a month. So we didn't pick patients. We had a bag of brackets and we all got excited. And we just, every patient that came through, we started in Ultima. So it's really great to see that it's a representative sample of what comes through our practice. And you're doing a great job. And it's just so fun to see, how in a short period of time through phase one that you're really almost halfway home. So nice job.
Hey, thanks a lot, Mike. Thanks, Tom. So moving on, this is Jaden, the patient number 4. And again, as Mike detailed, these brackets came into our practices. We got about 32 cases going just on really whoever walked in the door. So this is Jaden, and you can see quite a bit of deflection in that 14 copper. Again, the round wire stages. And what I wanted to do is just tease out a finish. This is Jaden in 11 months. And that's the day of debanding right there. You're seeing the occlusion. And, I love seeing the posterior development where the canine introduces the 4 and the first bicuspid introduces the second bicuspid and so on and so forth. I really like looking down that buccal corridor and just seeing, no one tooth is sticking out to you. So the finishes are all what we've been accustomed to with our bracket selections and our bracket prescription of what we've been using. It's just how we're getting there is just different. And in Jaden's case, I probably wouldn't have been able to do this in 11 months with the Q2 bracket. So I just wanted to kind of tease out a finish there. And you can see the upper arch before and after and the lower arch before and after. The first visit back, 18 copper. And, please pay attention to those upper ones. Again, it's like patient 2. These upper ones, for me personally, would just haunt me. And I never knew if the rotation was going to come out with the 14 by 25. So you can see the 14 by 0275 Ultima wire, there is deflection there. And you can see full expression in the 4th visit, slide number 3 there. We're pretty much rotation free, in my opinion, on the upper arch. Now, just to amplify those upper ones, and then the full expression of their 14 by 0275. And I know Tom's going to really hit on this, as I hand it off to him with that 1825 wire, how we're starting to get the angulation and the inclination control there. Here's Jaden's lower, and I'm going to show Jaden's lower for one reason, not just the rotations, but I made some mistakes here, and it's very important to point out our mistakes. The Ultima bracket, in my opinion, is going to make us better bracket placers. We're all striving to get better every single day, and we study our bracket placement. That's why I love the post-bonding photo. I mean, this is the day he got braces. I can analyze where I've got the brackets on. I'm studying them now, and I think I've got the brackets in relatively good position. But as you see Jaden unfold here, here's the 18 copper. You can see the rotation still present in that lower anterior region, mainly that lower left 2-1 area. And then you can see the 14 by 0275. There's really not a whole lot of deflection in that wire, and I still have some rotation between that 2-1. And then the 4th visit back in picture 3, wait a minute, what happened there? We still have the rotation. It really looks kind of the same as it did when I put the Ultima wire in, the 14 by 0275. So what we need to do is we still need to remember the pan repo. We're not going to be perfect every single time. And you can see I did some repositioning with the lower right and especially the lower left 2-3. I did the lower right just based on root position. I needed a little distal root tip on that lower right 4, but the area I really want to pay attention to is that lower left 2-3 area. Did some repo, and then you can see I retied that 14 by 0275 Ultima wire. Boom, the rotations are out. So I think it really, in our practice, it's really making me focus on bracket position and really just being a fantastic bonder of brackets. And that's what I strive to. And I know, Tom, I know, Mike, you're doing the same thing, but we're going to make errors in our bracket placement. And I don't know if you're seeing the same thing where Ultima will expose a bracket error, a bracket position error. In my opinion, that's what I'm seeing.
Well, to that point, in the past, when you saw a tooth hang on to a rotation that was stubborn, even if you went to repo it, sometimes you'd put the wire back in and they'd come back and you'd still see the same error. And
absolutely,
a lot of that wasn't because of bracket repositioning. It was or the bracket position initially. It was just because there was so much passivity in the system that you couldn't express that deflection to get the rotation. What we're seeing with Ultima is, you definitely know when you have a tooth that needs some extra activation, you can look and you can visualize the bracket positioning error a little bit better. And when you go to reposition, pretty confidently when they come back, it's going to be corrected. And that's a big issue that's a huge improvement.
In talking about exposing the rotations or errors in bracket position, prior systems, more passivity before the 0275 dimension, you didn't really get your rotational control, until you got to your torque couples later on down the line in bigger wires. So the beauty of this is, right after that 14 by 0275, if something's not looking right, there's only one thing it can be, Todd. It's a bracket position error.
Yeah.
Moving on to Mason, and I'm showing Mason for another reason. You don't see a lot of rotations in there, maybe a little bit in the upper right 5 and the upper left 2 area, in the upper left 5. I'm showing Mason. Mason was a class 2 div 2, and I don't bond the lower arch in these cases. That's why you see the open core springs. I like to move the incisors facially and create overjet in these div 2 cases, then bond the lower. But I'm showing Mason for this reason right here. And this is really, really cool. So the first visit back, I put the 14 by 0275 Ultima wire in, and you can see I took those open core springs out, upper 3 to 2. And this is about the time when the lower braces went on because I've got enough overjet now. But here's what's really, really interesting. The third visit back, I had the expression of the 14 by 0275. And so what I did is I like to start consolidating space. So I like to move the upper 3 to 3 together. So I have elastomeric E-thread, textured E-thread under the wire, and I've just, ligature tied upper 3 to 3. Here's what's really gets me jazzed up here is the fourth visit back in slide 3. You can see where the space is closed. Not only did the space close, because we're all gonna have these stingy, painful spaces that will either come up in this stage of treatment or in later on. But I closed the space pretty efficiently, pretty quickly rather. And not only did I close the space, but look, there's no rotations. I mean, how many times have we gotten to the finishing stages? And I know Mike's going to hammer this when he talks about finishing, but how many times was a rotation not even ever there? And now it comes up in finishing and we're like, what in the world's going on? We're closing this stingy space. Most of the time it's between the upper 2 3s. And then lo and behold, a rotation comes about and it may not have ever even been there. And Tom, you said this previously in our last slide about the passivity of the system. So what were we doing? We were cheating the brackets, maybe a little mesial, to get that activation because there was so much passivity. But what I'm seeing here, and I'm sure you'll agree, and I hope Mike really hammers this in finishing, is we're getting space closed in the 14 by 0275, and by and large, we're doing it without developing rotations.
Well, Todd, if you don't mind me jumping in, exactly what you said. When we think about finishing, what I really want to kind of drive home in finishing is it's not what we do at the end; it's what we do along the way, right? And we've all seen cases, and this is a perfect example of one where we're trying to, create something where we can consolidate space, which you're showing that we're doing earlier. But we all know that there's going to be something that is a trade-off, right? Maybe we rotate the canines, maybe there's a little bit of axial tipping that occurs. And then we go ahead and we add that to the to-do list later on when we go to clean that up and finish. Well, what you're seeing here is that you're not adding it to that to-do list. So by definition, you're already finishing your case now in your first rectangular Ultima wire, or this wire that has kind of a dual rectangular round wire characteristic phase. You're not seeing any of these side effects, and for me, that's the most exciting part, because you're getting the confidence that you can move teeth without having a secondary side effect, and B, you don't have to clean that up at the end. So you can consistently move a tooth from point A to point B and know that you're actually finishing your case right now in the early rectangular phase.
And that's key. This increase in efficiency that we're seeing with the system, this is a perfect example of that.
Yeah, I love how you put that. I mean, we all need to get in that mindset, is start with the end in mind.
Yeah.
And that goes from the bracket prescription. And I know Tom's going to get into this with, we used to call it low and high torque and standard, and now we're moving towards a more of a neutral and a procline and a retrocline. Yeah. So it starts there, but I love how you put that, is we need to think about finishing every stage along the way. And you're right, we are finishing in these Ultima wires, we're doing finishing mechanics along the way. So thanks for bringing that up.
Yeah, no.
So here's Mason's lower, just to kind of go over that. This is when we bonded him after we got that overjet. You can see the deflections in the wire right there at bonding. And the 14x0275 I put in at the first visit back on his lower. You can see the deflection between the lower left 2 and 1, and then full expression there. And it just looks really clean. The cases just look really in control at this stage. The last case I'll go over is this adult, and this really hammers home being efficient. Like Tom just said, being efficient in our cases. And I don't know about you guys, but I'm seeing a real uptick in adults seeking care. They're coming into our office and they're saying, "Hey, I'm in Microsoft Teams all day. I'm looking at my smile on my teeth in the camera, and it's driving me crazy, and I want to get orthodontic treatment." So we have to be efficient with these adults. Most adults will go into braces or ortho, but they don't want to be in there 2 years. So what I'm going to do is show you another little tease finish. She was another 11 months, 8 total appointments in our office. Now, you can see nice key 1 finish. This is right after COVID. We haven't talked about COVID in this study. So we launched this study in November of 2019. And then what hits in March of 2020? COVID. Most of us shut our practices down. Me personally, I shut it down for 8 weeks. But when we first came back May 9th, we weren't using high speed right away. So apologize for the enamel looking the way it did. We had to go back in and polish her later, but we were just using scraping instruments at that time. But just to tease out a finish there, you can see the upper and lower occlusals and the lower occlusal there. And as we jump into this case, I made another mistake, and I want to point that out to you. But the first visit back, I've got an 18 copper in there, and you can see the rotations, not only in the bicuspid region, but you can see it in the upper right, 3-2, 1-1. It's got that overlap in the ones. I mean, that just must be in the area that I practice. Is you can see the 1-to-1 rotation in pretty much all these cases. So you see the 14x0275 Ultima wire in the middle of your screen there, and then full expression. We're almost rotation free. I can see maybe a little bit of deflection in that upper right 3-2. And I think Tom brought this up earlier. When you've got that, just don't go to the next wire. When I hand this off to Tom, I'm not going to put the 18x0275 Ultima in there. I'm just going to let that wire cook a little bit longer. So what happens? Right there. Just wait another appointment. So that deflection, in my opinion, came out with that upper right 3-2. Now, here's a mistake. So don't forget your round wire mechanics that we're all talking about. So I've bonded 7-to-7 here. There's a 14 copper. Rotations pretty much all over. But the lower right 3, in my opinion, if I'm going to treat her again, I'm probably going to do an open coil, a push coil there, and leave that bracket off. There's just too much deflection in that wire, in that round wire. And that tooth is just, it's unable to rotate. So you'll see that with the 18 copper. We've still got a lot of rotations in there, and especially that lower right 3. I couldn't even engage the 14x0275 Ultima wire, so I had to put some elastomeric ties on there, which is, I don't like to do that, but we're in a study. I'm kind of in a hurry, and I made a mistake. I wouldn't do it this way again. But so what I had to do is just spend more time in that wire. So picture 3, there's still a deflection in there. And I just let it, same thing I did on the upper, I did on the lower. I just let it cook more. And it took a little bit longer to get those rotations out. But
well, Todd, I mean, I think that, we all beat ourselves up when we review these cases. I mean, I can tell you, as I've gone through mine, I just cringe at all my little mistakes. But
you're right.
this also shows the power of the transverse. I mean, I think that the obligation of Ormco and this system is to develop a very highly engineered system, but we still have to know that biology is biology, right? So you can't really unravel that rotation until you get the arch length, which is going to happen by the transverse. And that's where that round wire phase just takes time. And then that early transverse uprighting that we've all seen and known for the last, couple decades with PSL, you're still going to see. And until that happens, you're not going to get that rotation. So, I think that it's we can all look at this and we can learn from it, but at the same time, I mean, it's still amazing how quickly and efficiently you've worked out that crowding and those rotations. So it's definitely focus on that too.
Yeah. And these cases that you say that, well, I made a mistake here, the teaching value is very high in these cases when you show cause and effect. So if we all showed our pristine best cases we ever treated, there's not as much teaching value in those cases. So thanks for that, Todd.
Yeah, and thank you all for those comments. I mean, just like Dr. Damon said in his introduction, we were all doing iTero, or scans. We were doing scanning of the teeth every single month, taking photography before the visit, taking photography after the visit, and it was painful. And as we dive in, I frankly learned a ton in this study, and some of the findings I saw, I wasn't really proud of myself. And I'm like, why did I do that? So I think that reflection, and that's the beauty of orthodontics, is we can learn from every single tooth. We can learn from every single case.
Well, how great is it going to be when we can tear up these cases and all of us can have access to looking at how we've treated these? I mean, I think that it's going to allow us to be better as a profession, better as clinicians moving forward. And I get jazzed up when I see this. We all sit in our little bubble and we watch how we treat things. But as I've been exposed to other clinicians and how they treat, I could tell you I learn something every day, and that makes me just so much more curious than I ever have been. So it's really awesome to see. Nice job. It looks fantastic.
Yeah. As I hand the next segment over to Tom, he no longer, in my opinion, has to worry about activation in a rotational standpoint. I showed you those slides where the 14 by 0275, wasn't filling the slide. It was still a passive system. As he transitioned into that new 18 by 0275 Ultima wire, he's going to really have a lot of control, angulation, and inclination. So I really enjoyed seeing what Tom has. Thanks a lot.
Thanks, Todd. Yeah, and I'm really, as you said, excited to talk about the 18 by 0275 wire and the torque control. Cases are set up pretty well in after the 14 by 0275. So as Todd talked about, rotational control with the 140275 is now known as phase 1 of our treatment with Ultima. Phase 2 is torque control, and that's what we're going to get with the 18 by 0275 wire. So passivity is our friend in passive self-ligation. It allows us to reduce frictional binding, frictional resistance and binding. And that's key in lowering the biomechanical load that we deliver to the teeth and to the alveolus. So passivity is our friend. It really makes it work. And I couldn't do cases like this on the left before without extractions, before passive self-ligation, without extractions, without separating the mid-palatal suture. And with passive self-ligation and Dr. Damon's protocols, we're able to do cases like that. So that is the beauty of low friction, low force. So where passivity is our friend, it also presents challenges for three-dimensional control. My practice was one of the 10 practices involved in the Damon Ultima clinical study, where we saw about 196 patients. And time constraints being what they are, I've selected 2 cases that I treated from the study to really give good examples of the torque control after the 18 by 027 wire. Torque selection is key, but don't forget, a good percentage of our profession does not use variable torques. Yeah. They're using just standard torques. And we're not going to be talking about the overdrive wires, but we'll allude to those. There are wires that are 19 by 0275 and 20 by 0275 that will allow you to get some control even with the standard torque brackets.
Well, and I think, like what you guys are discussing, the key to this system that's so beautifully engineered is that even if you're in a neutral torque bracket, you're going to get to where you want to go. I think that the variable torques just get you there faster. And you can't really overexpress. I mean, it's a wonderful design. And if we're trying to increase efficiency and engage that torque couple earlier, then the variable torque brackets are really going to aid in that. But if you are using a neutral torque bracket throughout the bracket line, you're still going to end up with a wonderful torque control and a beautiful finish.
All right, well, let's look at that first case that I treated, that I've selected to show, patient SV. So here she is pre-treatment, and obviously it's a class 2 division 2 malocclusion. It's 110% deep overbite, and so much so the upper incisors are so retroclined that she is stripping the tissue away from the lower incisors. It doesn't show on that, but she has a thin biotype. Just looking at the film, you can see it's a very low angle case, brachyfacial, and you can see the degree of retroclination of those upper incisors. So we've got a lot of work ahead of us to get the proper torque on those incisors, and more importantly, to hold it while we're running the class 2 mechanics.
And Tom, the curve of speed on that film too. I mean, I noticed that on that lower. That's a whopping curve of speed there.
It is, and I'm going to show you how we open this bite. So here's the torques that I selected. I picked high torque upper canine to canine and lower canines because they were tipped in somewhat. Now with class 2 mechanics, we would typically put low torque brackets on the lower incisors. I elected not to do so in this case because of the thin biotype and the stripping of tissue caused by the upper incisors on the lower. So looking at the treatment sequence, we won't spend a whole bunch of time with this, but we start out as we normally do with our round copper nitrile wires. And in this case, I started with short class 2 Ormco quail elastics, which are 3/16 2 ounce. Now, Dr. Damon talks about judicious use of early elastics, and I agree with that. I don't use them in every case, but I did in this case, and we'll show you, my rationale in another slide. So I went from the round wires into our 14 by 0275 Ultima wire. And I just made the progression up to the 018 by 0275. I started short class 2 rabbits at that point, which are a little bit stronger than the quails. When I finally get to my 18 by 027 wires in both arches, I did full zebras rather than shorties, which are the 5/16, 4.5 ounces. We continued elastics through the remainder of the treatment. In my progress, pano, and repo, I did drop down a wire because I repositioned a few brackets. Got right back into my 18 by 0275 steels, and I continued elastics until we finished the case. All right, let's look at the initial bonding. So it's a very deep bite, 110%. It's a very low angle, and I put these very large anterior bite turbos on the lingual of the upper incisors. And you can see in the photograph on the right, she's biting together, and we have really disarticulated her. So you can imagine it's hard to live your life when you have that degree of disarticulation and eating and so forth. So I did tell the patient and the parents, look, if you can't tolerate these, I will take them off. But if you can hang in there for a little bit, it's going to really, we'll be able to do things a lot quicker mechanically. And you can see that with the disarticulation on the right, we've got her in the shorty class 2 quails. And what we're trying to do here is not so much class 2 correction, but erupt posterior teeth. So as you know, in a brachyfacial case, in that lower deep curve of speed, that's exactly what we want to do is erupt posterior teeth. Now, Todd mentioned that we started this study, in the midst of the pandemic. So this case was started in February, right before the pandemic started. And then I had about almost a 10-week shutdown. So appointment number 1 was at May 11th. And you can see in one appointment, I virtually corrected that 110% deep overbite in this Div 2. So that's why I judiciously chose to use early class 2 elastics in this case.
And Tom, thanks for pointing out with that 110% overbite, we can really see, I now understand, because I would have put low torque on that lower 2 to 2. I can see why you put the neutral because of that thin biotype. Now we can really see that in that appointment 1.
Exactly. With the thin biotype and roots forward to begin with, I was just hesitant to put a little more labial root torque on those lower incisors. All right. So there's one appointment, correction of the deep overbite. So what we want to show, obviously my part of the lecture is showing torque control with the 18 by 275. So what I did was 4 weeks after my patients had been in the 18 by 275s, we took some pictures to take a look at how it compared to the original torque. So here she is at that point, a month after the 18x275 has been in. And I want to show you the initial bonding on the left and the 18x0275 on the right. You can see the degree of torque that we've achieved by the time we've gotten out of that wire. And if we zoom in and you take a really good look, let your eye go back and forth between the initial bonding on the left and the 0275 on the right. You can really see, bracket wire relationships and the degree of torque that we got after this wire. The key is the combi wire, as Dr. Damon calls, half round and half rectangular, hitting those torque couples and really expressing the torque. So here she is when we finish the case, and you can see the lower thin biotype. I wasn't sure if I would flare the lower incisors with the class 2 mechanics. I really did not. Maintain them about where they were. All right, so this case was done in 9 working appointments in 11 months. And don't forget, this was during the pandemic, so that 11 months includes 2.5 months of interruption for our shutdown.
That's pretty, it's just impressive. I mean, when you see that the key to that case is truly the upper incisor torque position, and you look at her finished case, it's, we all know we can get there. It's just how long would we normally quote that patient as far as time? We know that we're going to take a long time in the round wire phase. We're going to have to wait for torque expression. So to see where you were able to go from point A to point B, irregardless of the shutdown in 11 months, is really showing the power of that third dimension of torque control in this case. I don't know if you agree with that, Todd, but it's quite amazing.
Yeah, and I'm really glad Tom showed that class 2 div 2 case here, because as you remember mine, I did those open coils, created a lot of space. I couldn't have done this case in 11 months because I don't bond the lower. But after seeing that blessing Tom got just by that patient being gone for 2.5 months, I mean, I'm just, that is just amazing.
Yep. So that was key. She was able to tolerate those turbos. And if she didn't, then it would have not probably treated in 11 months. Now, we did not have the overdrive wires at the time we did this part of the study, which were the 19x0275s and the 20x0275s. Could I have gotten a little more torque on the upper incisors? Probably. I'm not a wire bender. I'd rather reposition brackets than bend wires or select the right torques. So maybe I would have put an overdrive wire in there at the end to get a little more torque in the upper incisors.
Well, Tom, I would say that one thing that I'm learning with this is that as we start to progress through our Ultima wires, it's giving me a much clearer picture on what bracket I should put on to express that torque. So, I was a little bit more cautious in the beginning and using neutral torque on certain teeth. And what I really found was, midway through, we were like, hey, let's take that off and put a procline torque on, because we know that we're getting that torque expression and we want to see a little bit more of it. So, it is a learning curve. We went back and treated the cases that we've treated initially. We would probably have a much different torque selection from the beginning, or like you said, we would use the tools that Ormco is giving us as far as the wires. And I'll talk about that a little bit at the end, about these little bit, we're calling them overdrive wires that allow for more torque expression. But nonetheless, I mean, we're all beating ourselves up, but it really just very impressive.
Well, thanks. That was case number 1. Let's look at case number 2 that I've selected here. So at first blush, this case doesn't look like a particularly difficult case, right? Why are you showing this one? But it is a subtly very difficult case, probably much more difficult than the first case we showed. Looking at some numbers, what I want to show here is that the lower incisor is almost at 99 to mandibular plane. So we've already got some degree of compensation in this class 2 case with the lower incisor. So again, is this an easy case for PSL? Well, we've got a half cusp plus class 2. There's no overjet. I've got small upper laterals. We've got lower incisor compensation. And to make it matters worse, I've got to pull class 2 mechanics at the same time. So without precise torque control, it'll be very challenging to finish this case to a class 1. I think you'd all agree. Mm-hmm. I mean, think of what we used to do, Todd and Mike, in these cases, strip the lower incisors to tuck them back a little bit to create overjet. Maybe have the dentist bond the upper smaller laterals to get us some more overjet, bending torque into the wire with an indeterminate amount of force when we do that. All the things that we used to do to work hard to get these types of cases finished. So let's look at torque selection. It's a class 2 case. So I've got procline or high torque brackets on the upper incisors, retrocline or low torque on the lower incisors. I felt the canines were tipped in a bit, so I put high torque brackets on the lower canines. Again, the wire sequence, nothing new here. It's starting with the round copper nightie wires and working our way through our 14 by 0275s, 18 by 0275 copper nighties, and eventually to our 18 by 0275 stainless steel Ultima wires. So I did place some accentuated curve of speed in the upper arch and reverse curve in the lower because the bite was a little bit deep. We continued elastics and I debanded the case. So let's take a look at what happened after the 18 by 0275 wire. So here he is. The wire had been in 4 weeks, and this is how we're shaping up. This case, I did have small turbos on the occlusal surfaces of the upper first molars in this case. So here we are, initial bonding left, and 18 by 0275 Ultima wire copper nightie on the right. So let your eye go back and forth between these two circles. Initial bonding, and you can see, if you go back and forth, you can appreciate the degree of torque that we have achieved in this 18 by 0275 wire, and also getting a little bit of overjet as well, which is going to help us in our class 2 correction. All right, again, you get a sense of the degree of torque that we've achieved with that wire. And if we zoom in, you can, again, let your eye go back and forth between initial bonding left and 18 by 0275 on the right. And you can see the torque expression on those teeth. More importantly, we've got to hold that torque couple while we're running our class 2 mechanics, because that's going to tend to want to dump those teeth on us. So here he is finished up. Nice result.
Wow.
Yeah, really nice.
And we took that, half cusp plus class 2 with no overjet and small laterals and, compensated lower incisors, and we were able to get home to class 1. And what amazed me was we were able to do it in 8 working appointments in 11 and a half months, which again included a 2-month plus interruption because of the pandemic shutdown. So I don't think I could have done that with prior, iterations of our passive self-ligation appliance. Which brings me to a little pearl that we can talk about with this case too. So we've got slightly small upper incisors, maxillary lateral incisors. And the pre-treatment pano showed that they were very upright. So if we go back to Larry Andrews, 6 Keys to Occlusion 101, incisors occupy more mesial distal space when they're angled properly. So if we just take those upright laterals and we get the proper angulation, the proper distal root tip, we're going to make them appear bigger and take up more space in the arch, which helps us in this case that is lacking in overjet. So you can see when we finish the case, better angulation. And it brings me to my close. I want to quote a colleague and friend, Mark Olson. He wrote in one of the articles he wrote for JCO, he talked about acceleration and efficiency. And he said of acceleration, it means increasing the rate of progression toward a specific goal. He said efficiency means employing the least possible effort to progress toward that end goal. And this is the true definition of simplification. And he really says it best when he says, our goal as orthodontists should be to increase efficiency rather than to accelerate treatment. Because if efficiency is improved, accelerated treatment will follow. And I can find really no truer summary of what we're able to do with the Damon Ultima system. And if we can do this on a consistent and repeatable basis, in a predictable basis, our practices and our profession will thrive.
What I love about your ending is you talk about efficiency and thriving. And I think all of us, when we started this Ultima study, we were just jazzed up about how well the system was going to work in theory, right? I mean, we understand it from an engineering standpoint. So if you can remove the inefficiencies, we all figured that it would make it easier and have a better patient experience. What I think we all saw as a side effect is how much the treatment time was reduced because at the end there wasn't much to do. And that to me is just the beauty, is that we get all three, right? We get to improve our patient experience, make our lives a little easier, keep it simple, and also shorten up treatment time. All right, so in my segment, I want to kind of dive into kind of finishing these cases up. How do we bring the case home? And we've kind of alluded to the first phase of rotation and angulation control, and the second phase of torque control. And now we have to figure out, how are we going to get this patient done with braces off? And we all know that can be quite challenging. So let me just right in this and kind of give you my thoughts on that, and we can kind of go through this. So how do we finish with the Damon Ultima system? Something that kind of keeps coming in my mind is something that I've heard Dwight just say over and over and over every time I've got the opportunity to hear him speak. And we need to think about finishing with the end in mind. So what does that mean? It just means that when we're looking at a case from the beginning, we have to think about how we're going to treat it. And we all do this, right? We see a patient for a consultation. We're already thinking about, what are the mechanics going to be? What do I want the smile to look like? And then when we bond braces, we're trying to recreate in our mind what we want. And then as we progress through treatment, we have this idea of what we're trying to achieve, and we hope that we get there. And if we do, then we have a successful case. Just as, Todd had talked about with phase one, he talked about rotational control, and with rotational control comes axial control as well. We can get root tipping and angulation exactly where we want it because of the dimension of that wire. And with phase two, Tom couldn't have shown anything better about anterior torque control. It just was really a great way to show that. So what I kind of view finishing as isn't something that we do at the end. It's something that we do at the beginning and in the middle. So what I'm looking at when I see phase one and phase two is that there's just less on the to-do list. If we get to the end of treatment and we've already got rotations, inclinations, and torque worked out, then there's not much to do at the end. And that's kind of what I want to kind of demonstrate here. So one of the things that, after being able to look and present cases on finishing, what I've realized is that most people believe finishing is something that you do at the end. If you get a group of orthodontists and you say, okay, let's talk about finishing, you would see about 50 to 60% of the orthodontists raise their hand that they think that finishing is bends at the end or details. I think I want to challenge that and say that it's everything that we do in the beginning. And I think that with Damon Ultima, it just is a wonderfully engineered tool that helps us get from point A to point B faster so that we can achieve these beautiful results that we want. So let's kind of talk about finishing. So outside of the Damon Ultima system, outside of even PSL, we all still have to be orthodontists, just like Todd talked about. And there's some key points to finishing that we all have to think about. Whether you use differential torques or not, that is going to help us get to the finished result faster, right? So if I have teeth that are all over the place and I see that there's an opportunity to express torque a little bit more efficiently, then if I have a bag of tools that gives me something where I can add a differential torque bracket and then I can engage that torque couple faster, then it really is going to increase the patient's experience because I'm going to be able to finish it faster with a lighter wire, which means less sensitivity and a better end result in a shorter period of time. So, we all have to make sure that we're choosing the right braces. But again, even if we don't choose differential torques, the beauty of the system is that we can still get home. But I always want to make sure that I'm trying to knock all the boxes out. The second thing we want to do, we always have to make sure that we're bonding purposefully, just like Todd talked about. I do think that this system is going to make us all better bracket positioners because we see the errors when we get to our mid-stage wires. Now, in a case like this, which I'm going to show, we have to make sure that we're bonding for smile arc, we're bonding for functional occlusion, that we're making sure that we create a wedge coming all the way back from the first molar and not just the anterior teeth. We want to mimic that lower lip line, all the things that we talk about. So this is something that's not just specific to Ultima, it's specific to us as being really, really good artists as orthodontists. Another thing that we want to look at is evaluating our cases. We get a beautiful opportunity with Ultima to see torque expression, rotation control, and axial control very early in treatment. We don't have to wait to the end to figure out that we need to kind of correct something, because when that happens, let's be honest, many of us don't go back and reposition a bracket when we're in a final wire. We just make a bend. And when you make a bend, what we don't realize is that if you make a first order bend, you're actually making a second, third order change. And then you're it gets a little bit confusing and you don't really know where you are. With this system, we can see the errors and we can see what changes we want to make pretty early in the Ultima wires, so that you can then choose either a different torque, reposition for a vertical change or an axial change. But we have to pick those time periods. And for us now, it's going to be in that 140275 combi wire before we even get into the 180275. And then lastly, we still have to remember that the end result is a function of not only our bracket system, our symmetry, our arch form, our posterior development, but it's also hard and soft tissue management. So, really take the time to look at that. Now, one of the things that I feel blessed about with this system is that if we can get from point A to point B a little bit faster, it gives us more time to focus on those things at the end. I mean, in 11 months, our patients aren't yelling at us to take the braces off. So if we have an extra couple months because we've already been efficient with treating first, second, third order, it gives us a little bit more time to work on soft tissue, hard tissue, and really, really dial in that smile to make it perfect. So we have to remember that these keys are inherent in all systems, and they're going to be much, much more visible in the Damon Ultima system. So now let's kind of get into the system itself. I asked myself, that's great. How does the Damon Ultima system help us finish better and make a better experience for our patients? And I do think it's because of the precise engineering that went into this. And that started with Dr. Damon's thought process. Again, you'll hear him talking about crawling into the bracket. I mean, and I believe that. I think that in his mind, he sees his house as a slot, and how can he interact in that slot so that the tooth, which is attached to the bracket, is going to have an express torque. And with that thought process in the engineering, I think that we have a much better direct path to the final tooth position. But if we break this down, how does an improved bracket allow us to finish easier? We just have to equate that, right? I mean, can that happen? And if we look at this, there's actually quite a few technological changes in the bracket, some from comfort, some from style, some from how it's fabricated. But the biggest change that I see is just the geometry of the slot. It went from a rectangle to a parallelogram. And what that allows us is that when we have different torques expressing between different teeth, whether they're variable torque or whether they're neutral torque, what's great about this is that you can see that there's a level slot lineup, which means that the wire that's functioning as the engine to this system is going to be rotating around one plane. Now, what that means is that we're not going to have first order or second order problems with this. It's going to allow these brackets to line up beautifully as the wires express. Now, what we all see is that when we start to work on torque, we may get a little bit of a vertical change of a 0.5 millimeter. And Dr. Damon showed that very, very eloquently when he presented his part of this. And I'm just kind of driving that home, that when we can have less variability, we have less problems to fix. And that allows us, just by technology, to finish easier. Again, we can dive into more about the technology of the bracket, but then how does the wire interact? I think that, to my knowledge, this is the first system that was designed to have the bracket and the wire work symbiotically together. Typically, we take a bracket and we pair it with a wire. These wires are made to work with the system, and they work very, very well. So when we look at this, when we take our first phase, if you will, and it's what Todd talked about, we get our initial alignment, rotation correction, early torque control. That's not just rotation. That's in an axial inclination as well, which is some of the beauty that we try to instill in our patients. If we have rotation correction, but the teeth are all over the place in a tipping standpoint, then it's going to create incisal edge issues. It's going to create gingival issues. So to have the control that we can get that tooth exactly where we want it very early in treatment is crucial. Secondly, when we get into phase 2 and we talk about torque control, we now have these couples that are going to start to work. Now, this bracket is shown in a passive state, which means that apparently this wire and this bracket have done their job, and now the tooth is in a nice position. But if we look at this from a proclining torque, or we look at it from a retroclining torque, we can see that as we need to apply torque to a tooth, that this bracket still has passivity, but also is engaging a couple very, very nicely. I like to call it almost point activation, which means that, we still have an active appliance, but it's only on 2 points of the couple and still gives us rotational control. So we're really dialing in that final tooth position. And again, as I'll talk, when we get into phase 3 finishing, we have these overdrive wires, which just start to fill the slot even more. And more importantly, we start to see that it expresses torque at a greater level. And I'll talk about that a little bit more. All right. So again, we're all skeptical of claims. We see the newest innovation, the quote game changer. I think that it's up to us as professionals and orthodontists to help our companies that we partner with to succeed, and also to help our profession, because it is a mutual relationship. But more importantly, we just have to show how these work. So I think that the system that we see here with this Damon Ultima study is we've got 10 different practitioners, all who, from my understanding, are all trained differently, who all have the same goal: improving a patient outcome in a shorter period of time in an easier fashion. So let's kind of see how that works. So I'm just going to show a case. I've already showed some of these photos, but this is Rhonda. She started. And again, just like we're all facing, I never really thought about that concept that people are on Zoom and they're looking at their teeth, but I have seen an uptick in adult treatment. Yeah. And what I have noticed is that adults just they have it in their head. They're like, it seems like anyone can do anything for a year. Right. But the minute you say a little over a year, well, how much longer than a year? Or if you say 2, heaven forbid, then, they're going to choose a different treatment modality. And sometimes we want them to follow a certain modality. So Rhonda was no exception. 48-year-old female. She came in with a list of concerns. All of them that I saw were solvable. Right. Smile aesthetics, crowding, smile width. And one of her biggest concerns, whether we like it or not, that she made very clear, was overall treatment time. And rest assured, I told her that we're going to manage that. So here's Rhonda 13 months later. Again, I think this is going to be a case that shows that I've knocked all of the check boxes off that I wanted to. Now, I can always find fault in certain things that I did. However, when I think of her list of concerns, my list of concerns, I couldn't show a better case in such a short period of time. And remember, we started this in November of 2019. So now it's February 2021. Just by definition, we have to show cases that are treating out beautifully in a short period of time. So let's get into Rhonda's case. Okay, so here's Rhonda's initial photos. Again, I'm not going to go through a full problem list, but there's a couple things here. One is she had a very hyperdivergent facial pattern, very vertical, a little bit of a lack of overjet and overbite due to some open bite characteristics, very constricted, and a lot of crowding, rotation, and torque issues. So I chose to use neutral torque on the upper and a negative torque or retroclining torque bracket on the lower 2 to 2. Here's just a quick progression. Again, I do believe in the round wire phase as being super important. So I started out as an 0-3, progressed to an 0-4, and then to an 0-8. We progressed to our Ultima wires, which was 140275 and then 18 for torque. And then in this case, I did finish in a little bit of an overdrive wire. However, the lower progression was the same. And, again, we saw these patients every 4 weeks and tried to change when it was reasonable to do that. A couple of the finishing and adjuncts, I did use some anterior triangular elastics to help with improvement of the smile arc in a shorter period of time. I did end up repoing the upper and lower 3s to a proclining torque just because I didn't like where it was going at the end, and I'll show that. So if we look at this just as a breakdown of phases. So case start, day 1, started with an 0-3 copper NiTi. And then you can see phase 2, this is after round wire and then into 140275. So this is what I consider to be close to the end of phase 1. I'm sorry. You can see that rotations are working out. We're getting really, really great posterior arch development. That's helping us with the crowding. I mean, in the lower, we can see that she started out with some gingival recession on the lingual. And as I progressed through this case, it did not get any worse. And more importantly, it just looked healthier as we went through this. But just in 5 months, we can see that, the resolution of the crowding through our posterior arch development was really key from the round wire phase and then into this ultimate wire phase with phase one just really started to work out. Got into our 180275 at 10 months, and you can see now our torque is working out beautifully, arch form, arch development. Now, this is key. There's not a lot to do here. I'm in an 180275. I've already repositioned. I've already swapped out some brackets for improved torque. When I get to the end, what does the end mean? The end means just making sure the case looks beautiful. And by 10 months, it was looking beautiful. So I had a little bit of elastics to do in order to close up the bite on the right side. But, you know, when we get to the end here, this is only 13 months. It was a little, just 13 months, I think, in a week. And it just shows the beauty of the system and the fact that I didn't have to go back and fix things. If we look at it from a posterior and occlusal standpoint, again, day one, 013, 014 copper nietize. Here's the end of phase one. We can see that rotations and posterior development are working out, and axial inclinations. Obviously, the upper right one has a little bit of a tweak to it, but it's working itself out. End of phase two, you can see that actually this is the repositioning appointment where I swapped out some of those torques on the threes, started some vertical elastics, and then finished case. Again, 13 months in a week. I couldn't tell you how ecstatic this patient was. By the way, in these patients in the Ultima study, we kind of beat them up. They came in every 4 weeks. We took 2 sets of photos. We took an iTero scan every visit. So these visits were involved for them, and she was beaming with excitement through this entire journey, which is just beautiful. So if we look at her smile transformation in a macro aesthetic view, we start case one, you can start to see posterior development, vertical starting to develop. We start seeing her smile arc kind of develop and torque. And then we end up with a beautiful finish where, you know, I think that it just hit all the buttons of what we wanted. Again, here,
very nice.
Yeah, thank you. I mean, and you know, look, this is something these are cases. It's funny, myself and the other doctor, Dr. Agarwal, in my practice, we're excited. I mean, we see this and, you know, we're already excited all the time about new technology, new treatments, but I could tell you, this is fun. It really is to see this, to be able to serve our patients in this fashion, to do it in a comfortable way. She felt very little pain, simply because I didn't have to put a lot of bends in a final wire. I didn't have to compensate for the inefficiencies of the system. I was able to do that through nice, resilient wires that are gentle, and she was very thankful for that. Again, a little bit summary. 13 months, 11 appointments. Here's her macro aesthetic view. We can see beautiful arch form, beautiful smile arc. Mini aesthetic right here, where we can just see it looks really, really good. And then even in a micro aesthetic view, just dialed in torques, tips, a little bit of enamel recontouring, very, very little. You can see that. Just super proud of this. And again, just something that's really fun. So, you know, when we think of phase 3 finishing, I mean, we're following a lot of the tenets that we followed with PSL. The only difference is that with the engineered system and with the way that this wire, Ultima wire, fits the parallelogram slot, you know, an 180275 is really where we need to go. Most of our major mechanics are done in steel wires in 180275 upper and 160275 lower. Obviously, we're still using light nitide coil springs to close and consolidate space. Like Dr. Bovenizer showed, really, really light power chain, but we're not getting any of those side effects from that when we're consolidating. With bite correction, you know, we're using light elastics in the beginning, and then we can ramp up as needed, but it's nothing that's really too overpowering on the system. It allows for really good posterior development. Remember, if we overpower the system and we pull really hard on AP elastics, it constricts the buccal segments. We want to make sure that everything's light and it's gentle. For arch form and width, we can shape these wires because they are steel, and then minor detail bends if we need them. I can tell you that very, very few adjustments need to be made to these wires, and that's something that's unique. I mean, I was working really hard and bending a lot of wire. And I have been with Q a lot more. Q2, it's been a lot less, but with this, it's almost non-existent. So, you know, that's a case of one, right? I think I bonded 15 to 20 cases, so I could have just picked the one that worked the best. Well, I didn't have a lot to pick from, so let's just see what happened in a couple other ones. I'm not going to go as far as detail, but let's just kind of, you know, jam through a couple more cases. Here's another kid, awesome guy, very constricted, unilateral crossbite, anterior crossbite, functional shift. His big issue was a dental alveolar constriction upper and lower, right? So we need the posterior development. We need torque control in the posterior. So it shows neutral torque, upper and lower. Again, arch wire progression is roughly the same: light wire phase, ultima wire phase, and then a final wire. I did use an overdrive wire in his upper simply just because I had it and I was testing what we could do. I think I probably could have finished him in just an 180275 steel, but I finished in a 190275 stainless steel in the upper. Again, some crossbite elastics to start, just to kind of jump that crossbite and get things moving. I disarticulated. I did end up repositioning the upper ones with a Procline torque, just because as I got posterior development, looking back at it, those were pretty upright. So I would have chose that from the beginning. But nonetheless, again, there's some issues that I have with his buccal occlusion on the left side. One of the things that I'm noticing that is an error on my side is that when I disarticulate, I use bite stops on the upper sixes. When you have 18 months to finish a case, it seems like at 12 months, 13 months, when you're taking off bite stops, you can get that posterior to settle. But, I'm seeing now that I don't have much to do when I get out of my phase 2. So now I'm really kind of looking at taking my disarticulation stops off earlier. The reason that I have a openness in the sixes is simply because this is the day I took the braces off and this is the day that I took his bite stops off. So that was an error. If I would have taken his bite stops off a visit before, I would have had a little bit of a better finish. But the key is 14 months, 11 appointments, knocked out all the check boxes. Another case, this girl, we had a young resident come in and I was showing him this case and he literally didn't believe that we did it in the amount of time that we did. And looking back at it, I kind of don't believe it either, but it is what it is. I started it in November and finished it in October, I think. But this young girl comes in. What I want to focus on is all the rotations in the upper. And then also there's going to be some vertical problems. This case, normally, if I was erupting canines and I had rotated laterals, I know that I would have created a torque problem in the laterals that I would have had to solve. And I wouldn't have been able to solve it until I got into my final wires. So I probably would have quoted this 18, 20 months before, but let's see how this played out. Neutral torque upper 3 to 3, neutral torque lower 3 to 3. Again, 0-3, 0-4, 0-8. Let those round wires work out. Got into my, my ultima wire phase 1 and phase 2 were finished. There wasn't much to do. Her teeth exfoliated, the ones erupted beautifully. And here's where she ends up in a very short period of time. So almost so fast that, I still have to watch the lower 7s because the lower right 7 is coming in a little angulated. We just have her coming back in 6 months. And if that tooth doesn't come in properly, I'll just bond that up and finish it. But you can see where she ended up, and she ended up finishing in 10 months. Again, we can all pick apart issues with this, but for me to get to this point in 10 months, 9 visits with very simple, straightforward mechanics, to me is something that I'm very excited about in the future. And as I learn the system and as I understand the errors that I'm making, I'll be able to dial it in even better, which I'm sure we're all excited about. One last thing about the Ultimate system is that it's not just a beautiful system created as is. I do believe that Ormco is working really hard to create a system that can get us from point A to point B faster, but also give us tools to use this as a very precise performance-based product, right? So, we're going to have a variety of wire sizes from 14 to 180275, a variety of wire compositions from copper NiTi to TMA to stainless steel. And in the future, we're going to see these things that we call overdrive wires. And what we're seeing and what we're looking at from an engineering standpoint is that for every 1,000th dimension that we go up, we're going to get 3 degrees of applied torque per tooth, which means if we're seeing a tooth that needs a little extra torque, we don't have to worry about flipping a bracket or doing something by putting single root torque in. We can just move up 1 wire size and we're going to be able to see 3 degrees of torque expression on that tooth that we want without negatively affecting the adjacent tooth, which, to me is just the most exciting spot. One last note, I cannot be more thrilled about the excitement of this technology. I think that, looking forward to the next 5 to 10 years and seeing what we're going to be able to do with this and how we're going to be able to refine this and improve our patient care is amazing. I do personally want to thank Dr. Damon for never quitting. I mean, we need people that bust through barriers and Dr. Damon always talks about his big head. Maybe his old football days allowed him the courage to push through these barriers. But, thank you for Ormco for believing in him, because we wouldn't be here talking about this and I wouldn't be able to show cases that if I look at the combined treatment time of those first 2 cases, that's the national average right now of a single case. So 26 and a half months, I think, is the national average. And those two first cases were treated in 27 months total. So when you think about the power of that we can treat two fairly complicated cases in the time that it takes to take one average case along the nation, we're doing something special. So thank you to Ormco. Thank you to everybody on this project. I can't wait to get together and really talk about ortho and geek out about this some more. But again, very, very, very thankful to be part of this and can't wait to see where this goes.